Good morning, UMA family. My name is DeJour Jones, and my business is called DeJour Jones Yoga Therapeutics. We will be doing some suitable for all chair yoga today. This is just my dining chair. Any chair will do, preferably one with no arms, but any chair will do that's stable. I'm sitting on a stool too, and if you have a stool that's stable, you can use that as well, or a bench, whatever you have. Couple of reminders: if you have any injuries, please take care of yourself. Be mindful of, if I ask you to do something and it's going to cause discomfort or pain, please don't do it. If you need a break, grab some water or the bathroom, a rest as well. Feel free to make that happen. So we will start, I'll start right here in front of you, then I'm going to move back into the chair with just some gentle neck circles. We're sitting up really straight, even though I know you can't see the bottom part of me, but my feet are flat on the floor. When I sit back there, you'll be able to see it a little bit better, but I'm sitting up really tall. My spine is lifting up, the top of my head is lifting up, and my feet are flat on the floor. Engage your belly button a little bit, pull it in a little bit. That turns on the muscles in the abdominal area, the abdominal muscles, I should say. And we're just going to circle the head slowly. So these we're going to do today can be done anywhere, waiting for an appointment, at home watching TV, or anywhere that you find yourself sitting. You can do these gentle exercises, and they are suitable for all ages. Doesn't matter how old. I really recommend chair yoga to the senior crowd or the older set. We start to sit around a lot more as we age, and the muscles shrink up and joints stop being as mobile as before. So it's really important to keep the body moving. Let's reverse the circle. Gentle circles with the neck. So you might hear some sounds coming from your neck, and that is okay. It's typically little gas bubbles that are bursting, that are caught between the joints, hydrogen gas. And so as long as there's no pain accompanying these sounds, there's nothing to worry about. And then come back to center, and then drop your head, left shoulder, left ear, or I should say left ear to left shoulder, and hold here. And then look up with your head, left ear, left shoulder. Look up a little bit toward the ceiling and just hold there. And then look down a little bit toward the floor. So we're not turning the head all the way, looking down, we're just doing a gentle movement. We'll start over. Left ear to left shoulder, start there. And we'll look up on a slight angle toward the ceiling. Breathing through the nose, and again, we're sitting up tall. And then looking down on a slight angle toward the floor, and just notice the feeling on the right side of the neck of the muscles getting a gentle stretch. Might feel a little bit of relief here if you suffer from a tight neck and shoulders. Look up again gently. And then down. And then lift your head to center, and then we'll go the other side. So right ear near right shoulder, hold for a few breaths. And then look up gently toward the ceiling. And then down toward the floor, slight angle. And then one more time, look up. And again, look down. And then head to center. Turn your chin towards your left shoulder. Just hold here and drop your shoulders down low. Sitting up tall again, breathing through your nose. Smooth and gentle breaths through your nose. And then chin toward the right shoulder. Again, shoulders down and relaxed. Long neck. Smooth breathing, and then we'll come back to center, and I'll move back into my chair. Let me readjust the... So we'll sit here, 10 toes pointing the same direction. Feet are comfortably separated, feet and legs comfortably separated. Now I jumped off my head. Scoot up. And we'll just sit for a second. So I want you to just notice your feet touching the floor or whatever's under your feet, carpet or a yoga mat, whatever you got. Just that contact point behind the thighs. That helps to get my head back in the frame. Noticing the contact points. The contact points on the backs of your thighs. Just have an awareness of that. Okay, good enough. We're sitting up away from the chair, so long spine, sitting up straight, and we're away from the back of the chair. Bring your hands in front of your heart. And I wanted to say, I purposely wore street clothes for this class because I want you to be aware that you can come to yoga in anything. You don't need the special pants or the special top or special, socks or anything special to do yoga. You come as you are. These are my they are pretty baggy jeans. I think it'd be a little more constricting if I had on tighter jeans. But just to show you that you don't need any special gear to practice yoga. A lot of people think they can't start whatever exercise until they buy the, shorts and they buy the tank top and the special, $200 sneakers before they can actually start to exercise or practice that sport. And that is definitely not the case. So bring your hands in front of your heart here. We're going to sweep out, sit up really tall, arms, palms touch, arms straight, palms touch. Then exhale, palms back down in front of your heart. We'll do 4 more like that. Here's number 4, sweep up, inhale. Exhale down. There's another one, sweep out and up, breathe in. This number 3, I think. 2 more, sweep out. Inhale, lift, sit up straight. Exhale down. This last one, inhale, sweep up, palms touch. Exhale, hands in front of your heart. We'll do something different. Sweep out, inhale, palms touch. Then exhale, bring the arms back down, palms down. Then inhale, arms back up. And then exhale, turn your palms down, arms down. We'll do 3 more sets. Inhale, breathe, reach. Exhale down. Inhale, up. Number 2. Exhale down. 1 more. Inhale, up. This time we're going to swan dive forward. So keep your back straight. Palms down, exhale. Hands come outside the ankles. Inhale, reverse the hands, come upright. We'll do 4 more like that. Palms down, forward bend. Keep your back flat, straight and flat. Inhale, come all the way up, palms touch. We'll do 3 more. Exhale, flat back all the way down. Inhale, come up. 2 more, exhale, forward. Inhale, come up. Exhale, forward. I'm going to hold here. So allow your torso to just rest on top of your thighs, or you can put a pillow on top of your thighs or a folded towel. You need to bring the surface of your thighs up a little bit to meet your torso. Just hang out here. It's harder to breathe like this, so do the best you can. Okay, we're allowing time for the low part of the back to struggle that we're in this shape, and then it'll release into a nice stretch. Just hold here, look down toward the floor. Hands are just resting comfortably on the outsides of the ankles. Smooth breath. And then inhale, sweep up. You'll notice how your back feels, palms touch. And then bring your hands back down in front of you and onto your knees or thighs. do some circles. So just moving the torso. Even though the torso is doing all the motion, this is really for the hip joints. So if you have tight hips, these are good to do. You can do them in any seated position. Doesn't matter what you're sitting on or where, what room you're in or what place you're at. It does none of that matter. You can do these anywhere. I do them in the car sometimes. When I'm in a parking lot or parked, say, and I can push my seat back. I'm waiting for something, appointment or whatever. I do these. They're called Sufi rolls, Sufi circles. Sufis are mystics or holy men or mystics over in India, probably other parts of the country as well. And my friend in Florida, her name is Jackie. She's named them Stir the Pot. So I actually like that name better because it makes me giggle when I think about it. But professionally or traditionally, they're called Sufi circles, Sufi rolls. Let's go the other way. We're moving the breath as we move the torso. So big breaths in and out. Throughout our every time we meet, no matter when it is, we're always breathing through our nose and we're doing really focused and conscious breathing. What I mean by that is we are really moving the breath in a way that we don't typically do in our regular daily living, because a lot of us breathe real shallow in our chest. You come back to center here. Bring your hands in front of your heart. So it's important. What happens when you breathe shallowly, you don't get a real good exchange of air that has oxygen in it. So your previous breath just kind of sits in your lungs and it has no oxygen left. So when we push that old air, old breath out in a forceful exhale, we make room for fresh oxygenated breath with the next inhale, and that breath, that oxygen jumps into the bloodstream and the blood and heart circulated around the muscles and the cells of the body and the brain, the organs, all of it. Okay. So hands in front of your heart. Take a breath in. Interlace your hands. Push your palms away from you. That's the exhale. Inhale, lift the palms facing the sky. Sit up really tall here. I'm going to turn sideways so you can see what's coming next. Then we're going to exhale and bring the arms back on an angle. That's the exhale. Okay, so you're getting a nice stretch in the shoulder caps and across the chest. That's an exhale. And then inhaling the hands back to the center. We'll do a few more of those. Inhale here, we'll do a complete cycle without me stopping. Inhale here. Exhale, push. Inhale, lift. Exhale, release. Inhale, hands in front of your heart. Exhale, push. Inhale, lift. Exhale, release. Inhale, hands to heart. Exhale, push. Inhale, lift. Exhale, release. Inhale, hands in front of your heart. We'll do 3 more rounds. Exhale, push. Inhale, lift. Exhale, release. Inhale, hands to heart. Exhale, push. Inhale, lift. Exhale, release. Inhale, hands and heart. And one more. Push. Exhale. Lift on the inhale. Exhale, release. Inhale, hands to heart. Let's hold here. Tip your chin down to your chest. I want you to see if you feel any difference in your being. And what I mean by that is we just pumped a lot of oxygen into our bodies. You might feel a little tiny bit buzzy, a little more clarity if you look out, a little more alert, a little more heightened senses. That's the oxygen in your body, particularly going into your brain. So that you're feeling droopy in your day, where you're feeling really lethargic and you still have half a day's work left. Half a day's worth of work left. So midday slump. You can do that movement and get some energy by putting some oxygen in your body. And you can also do that without the arms and hands. Just really for focused breathing and conscious breathing, what you're doing, okay? So bring the hands behind, interlaced and behind your head or your neck. Sit up really tall, so away from the back of the chair. We're just gonna do some gentle turns from side to side. So you can go as slow or as fast as you want. And try to take a breath in the center, an inhale breath. And then exhale, whatever side you're turning to. Inhaling center, exhaling to the other side. And come back to stillness. Drop your hands onto your knees or thighs and sit back in your chair. So again, you might feel that buzzy thing happening again because we just did a little more, it's called breath work, to get the breath and oxygen into the body. And you can do that as fast or as slowly as you choose. It's your choice. I tried to have us do it in a middle of the road kind of pace, so you can get that breath, that inhale breath on the center. So you can slow it down more if you want, or speed it up and go even faster. Let's cross the left ankle over to the right knee. This is a hip opener. So a lot of us are living with really tight hip joints, and it takes a regular conscious effort to keep them loose. And that means every day doing some sort of hip opener in your daily movement. So take your left palm and touch the inside of the left knee. Press gently downward. Just hold there and see what you feel in the left hip joint. We're going to compare sides. So try to hang on to the thought of the memory of how the first side felt for when we get to the second side. We're just gently pressing down. We're not forcing. Sitting up tall, drop shoulders down and breathing through the nose, as I mentioned. Checking the jaw, that it's not clamped shut. If it is clamped shut, just open up the arches of the teeth, separate them one from the other. And that will allow the jaw to not be clenched and tight. Okay, over time, a clenched jaw over years, it will debilitate your jaw over time. You'll have probably dental problems on the teeth in the back from them being ground down over the years. If you remember, and I'm prone to clenching my jaw, I've been practicing not to do it as much throughout the past couple of years because it does have a debilitating effect here. So we're still pressing down with the left hand, and then we're just gonna forward bend over the top leg. So you have a couple choices here. You can come all the way down and just let the hands hang, or you can use the inside of the left leg as a shelf for your forearms. Looks like this. So this might be comfortable for you. If going all the way forward is too much on your low back, you would stop here at option number 1. For the rest of us that want a deeper stretch, we can go and let the hands hang down for option number 2. And just wherever you are, just hold there. Take some breaths, some gentle, smooth breaths through your nose. And then inhale, sit up tall, arms up. And then exhale, forward bend. We'll do 2 more. Breathe in and lift. Exhale down. 1 more. Inhale, lift. Exhale, forward bend. Then hands on the inside of the left leg. Push yourself up to upright and place the left foot on the floor. Compare the sides. See how your right leg feels compared to the left. Take a couple breaths, and then we're moving to the other side. So right ankle touches left knee. Right hand presses down on the inside of the left knee. Pressing down gently. So I can tell you that my right hip is much tighter than my left. It's just doing a comparison. There's nothing wrong with me or nothing to fix about me. It's just the way it is. This stretch that we're going to do on this side will help a little bit. But hips are something that get tight, you know, it's a total commitment to keep them from getting tight. And there's different poses and exercises you can do um, to help that joint, those joints stay open. And less movement, the joints tighten up, the muscles get short. Okay. Bring your hands in front of your heart. No, we're just going to fold forward. Sorry. Just exhaling forward. Let the arms hang down. Look down toward the left foot, or you can use the kickstand on the inside of the right leg with the forearms and hold there. So find which place is most comfortable for you, and especially your low back, and just hold there. Take some breaths through your nose. And we'll lift for 3. Inhale, lift, sit up tall. Exhale, forward, bend down. 2 more, breathe in, lift. Exhale, forward. 1 more, lift. And exhale. And hands on the inside of the right leg, come up to seated. We'll go into final rest. So we're gonna sit back in our chair now. Comfortably, feet are comfortable. Let it all hang out. You can drop your shoulders down if you want to. And place your hands though somewhere comfortable that feels nice. So over your belly, on your knees or thighs, you can put hands over your heart. Notice your heartbeat. Experiment with where you'd like to place your hands. We're gonna just go through a little body scan again, noticing the feet, legs, hands, arms, spine, touching the back of your chair, your crown reaching into space. Back to the legs and back, touching the chair. Back to the thighs, touching the chair. Checking your jaw. Noticing the air on your skin. Any sounds around you in your room or outside, notice. I'm doing a diffuser of sandalwood and notice any smells around you. Smell that in the air. When you're ready, let's inhale and have one final stretch here. Reaching up really tall. One last forward bend. Come upright. Thank you so much for having me, Imani and Uma Clinic. I will see you next Wednesday. Take good care. Thank you.